I'm Glenn Campbell. I call myself a demographic philosopher. I'm looking at life and trying to predict the future through the lens of demography, or the study of human populations. Today I want to talk about triage. In a medical sense, triage is the sorting of patients and allocating of resources to save as many lives as possible. If you go to an emergency room at a big city hospital, triage is the first station you encounter. Here, a nurse is going to make a quick assessment of your condition and decide whether you need to be taken into the operating room right away or whether you can just sit in the waiting room for a while. Triage happens to be highly relevant at this point in history. Today is February 21st, 2020, because it's an important part of how we respond to the coronavirus epidemic. Emergency rooms around the world could soon be deluged with more patients than they can possibly handle, as has already happened in China, and somebody somehow has to decide which of those patients are going to be served and where they're going to go. That's literal medical triage, and how well it's done has a strong correlation with how many people die. But I'm also interested in figurative triage. In fact, I've built a whole philosophy of life around it. I call my philosophy Triagism. That's Triagism, Triagism. I invented this term about 4 years ago in November 2015 when I made about 4 videos about it, and I had forgotten about it until now. You can find these videos if you want by searching YouTube for Triagism, as I just spelled it. The basic idea is that every choice in life is a triage decision. You're trying to choose your own actions in such a way as to maximize certain benefits and minimize certain costs. For example, if you're visiting a new country for the first time and you've only got a 2-week vacation in which to do it, you have to make some triage decisions about which cities and attractions you're going to see and which you're going to skip. And you've got to make these choices in advance in spite of not having been to the country and having only limited information about it. But in this episode, I'm going to focus on medical triage because it's easiest to understand and it's most relevant to our current moment. But I hope you can see by the end of this episode how this could all turn into a philosophy of life. But before I go on, I want to describe the current moment. I realize that you could be listening to this episode months or years after I record it, so I want to summarize my current position in history. Today is Friday, February 21st, 2020, and the coronavirus has spread across all of China, and it seems to be on the verge of breaking out in several other countries, if not the entire world. The growing consensus among experts is that this disease will eventually become endemic, meaning it will become a permanent human disease, much like the common flu. The difference between this virus and the flu is that it is far more transmissible, meaning it's easier to spread it from person to person, and it's far more deadly. The best estimate so far suggests that it might kill 1 to 2% of the people who catch the disease, which is huge compared to the common flu, which only kills a fraction of that. Now, 1 to 2% may not sound like much, but if the whole world gets it, that's millions of lives lost. So this is something that no one can afford to ignore. I already recorded a couple of podcast episodes on the coronavirus on February 3rd and February 10th, so I don't want to repeat that discussion here. The most remarkable thing I've observed since my last episode 10 days ago is the high degree of denial here in the United States. Virus-related shutdowns in China have already severely disrupted supply chains around the world. Yet stock markets here in the U.S., like the NASDAQ and the S&P, are making all-time highs. This is just insane to me. But then again, markets have been insane for quite some time, thanks to central bank intervention. I still believe that this epidemic is the black swan event that will bring down the economy. The panic hasn't yet begun, but don't worry, it will. And since you're a denizen of the future, you know a lot more about this than I do. Today, all the disease experts on TV say they hope the virus will be contained, but I think that most of them understand that it won't be. The big challenge now is not stopping the virus, but slowing it down so new cases don't overwhelm medical resources. A relatively low fertility rate depends on people with serious complications getting adequate medical care. Even though hospitals have no cure for the disease, there are things they can do to keep people alive, like giving them supplemental oxygen or antibiotics for secondary infections. If people with serious complications can't get treated, the fatality rate goes way up. And if they can get treated, then the fatality rate goes down. Since there are only limited medical resources in any particular country, you want to slow down the rate of infection as much as possible so hospitals aren't overwhelmed. When hospitals do become overwhelmed, you get into the realm of triage. Triage is the sorting process that takes place when casualties first enter the hospital. Someone has to decide who gets treated and who doesn't, and how patients are going to be directed within the hospital. So what happens when a hospital with only 10 intensive care beds gets slammed with 1,000 sick people demanding attention? That's the essential triage problem. How do you decide who gets into those 10 beds? The general goal of triage is to save as many lives as possible, and that means carefully selecting the right patients for treatment. The default form of triage is what I call first come, first served. The first 10 patients who show up at the hospital's door get admitted, then the doors are barricaded and no one else gets in. The trouble with this method is that not all of those 10 people you let in are seriously ill. They might have survived anyway, but now they are occupying a bed that could have been used to save someone in greater need. You might also be admitting someone who is already too far gone. No matter what you do, they're going to die, so your efforts on them are wasted. The bottom line with the first in, first out method is that it doesn't save as many patients as it could. It's an inefficient use of medical resources that might end up saving only 2 patients when you could have saved, say, 8 patients. Another form of triage might be bribery. Only the richest people get treated. If you can slip some cash to the guard at the door, maybe they can let you into one of those precious 10 beds. But the problem here is the same as in the first in, first out method. You aren't maximizing the number of people saved. This method is effective only if you believe rich people are inherently worth more than the rest of us, so they deserve special treatment. A third method of triage might be to admit only your own family members and allies. You try to save your clan or the people who you identify with, and everyone else gets locked out. I can't say that this is morally wrong, because people do it all the time. They prioritize their own kin over someone else. All you can say is that it's not saving the maximum number of patients because some of those family members might not be seriously ill. The most effective form of triage is something called yield management. Someone takes a broad survey of all the 1,000 people outside the hospital's doors and selects the 10 patients who they think will benefit the most from treatment. You're going to ignore the people who are only mildly sick because they're probably going to survive anyway. And you're also going to ignore the people who are so seriously ill that they're probably going to die anyway. You don't want to waste your resources on them when those resources could be used for someone who might be saved. Finally, you might want to make a judgment call about who is going to most benefit others if their life is saved. For example, if you save the life of a doctor, that doctor might go on to save 100 other lives. So in an epidemic, it is appropriate to prioritize medical personnel. So there you have triage in a nutshell. It is simply the judicious allocation of resources to maximize final gains. The basic concept isn't hard to understand. Triage is difficult only in its real-world implementation. For one thing, you usually have to reject far more people than you select, If you choose 10 people for treatment from the 1,000 people waiting outside, the other 990 aren't going to be very happy about it. They might rush the hospital and ram down the doors and lynch all the doctors, in which case no one gets saved at all. Now, I've been thinking about triage since around 2009 when I wrote my first one-page essay about it. You can find this essay by Googling for Triage Kilroy Cafe. That's Kilroy, Kilroy, space C-A-F-E. And triage, of course, is Triage. The essay is called Triage, Doing What You Can with What You Have, back in April of 2009. Although I hadn't invented the word triage then, I pretty much captured the essence of it. Every decision is relative based on the goals you are seeking and the resources actually available. There will always be more needs than resources, so you have to judiciously apply those resources to achieve the maximum outcome. I've always thought of triage in abstract philosophical terms. Everything we do is an exercise in triage, but the coronavirus pandemic means that triage is now being practiced in its purest pragmatic form. Triagism isn't just academics discussing things. People are living and dying based on this philosophy. Prior to the outbreak, if you went to a hospital emergency room in North America or Europe, you knew you were going to be treated. You would still go to the triage nurse upon entering the ER, but this would only determine how long you wait. In wealthy countries not yet in crisis, there's usually enough medical resources to go around. The people who are shot up with bullet holes get wheeled into the emergency room right away, while others may have to wait for a while, but ultimately everyone gets served and an optimal number of lives are saved. In more of a battlefield situation, however, like a pandemic, triage decisions have a huge effect on who lives and dies. In this case, the triage nurse may actually have more power than the doctors in determining how many people live and die, because they are deciding who gets treated. In a modern emergency room that's not in crisis, every patient is evaluated in isolation. The nurse takes them into an exam room, assesses their symptoms, and decides what the best practices are for this kind of situation. There are all sorts of rule books and procedures for this, and a triage nurse can take pride in making the optimal decision for every patient. In a battlefield situation, however, you don't have the luxury of looking at each patient in isolation. You have to take a broad overview of all the patients who are vying for your medical attention. The decisions you make when the ICU has plenty of beds are different from those that you make when beds are at a premium and only a limited number of patients can be served. In this case, you have to look at all the patients and select the few who are going to benefit the most from treatment. Medicine in wealthy countries usually has the luxury of treating every patient equally, at least in the emergency room. It doesn't matter who you are or whether you deserve treatment or whether you have the ability to pay. When a doctor sees you, they're going to make the best decision for your case. This is true even in the United States with a notoriously screwed up insurance system. If you turn up at an emergency room full of bullet holes, a doctor is going to treat you, and they are not going to discriminate based on your ability to pay or whether you're a gangbanger who deserves to be shot up to begin with. Doctors, in fact, face great legal liability if they discriminate against a patient for almost any reason. If someone comes into the hospital with cancer and they're 90 years old, the doctor is obligated to offer them the same costly treatment that they would give to a 25-year-old, assuming that is that they both have health insurance. The doctor can't say, I'm not going to treat you because you're too old and are probably going to die anyway. That would be a breach of his medical ethics and could get him in trouble. Things change when you're in a pandemic situation and you've got all ages and conditions scrambling for medical attention. The triage nurse might have no choice but to discriminate. It's not a discrimination based on skin color, but a discrimination based on the probability of survival. If you have two patients with the same life-threatening condition, and one is 30 years old and the other is 80 years old, the triage nurse might select the 30-year-old for treatment because they have a better chance of survival. I want to emphasize how hospitals and medical personnel in the United States and elsewhere aren't set up for this kind of triage. Triage in America means directing a patient's treatment. Triage in a crisis situation might mean denying treatment altogether. Every medical professional in the U.S. has been trained to pursue the best practices for each individual patient. They haven't been trained to balance the needs and prognosis of one patient against those of another. They haven't been trained to look at 1,000 people and pull out the 10 who can most benefit from treatment. And they haven't been trained to ignore some patients and just let them die. This is the sort of triage decisions that a battlefield medic had to make all the time in World War I, but I don't think modern medical staff are prepared for it. They have been trained to give optimal care to everyone who comes through the door. They haven't been trained to balance the needs of the entire community to maximize overall survival. Consequently, I don't think modern healthcare systems in democratic countries are going to handle a pandemic particularly well. I think the kind of triage they will use, at least initially, will be the first-come, first-served method. All the hospital beds will fill up right away with all the first patients who come in the door. Then the police will be called, the doors will be locked, and no one else will get in. That's not to say that non-democratic countries will do any better. Right now, in February 2020, no one outside of China has a big picture view of how well the epidemic is being handled there. But I will wager that it's being handled poorly. China famously built a hospital in about 10 days, but that doesn't mean they have competent staff to man it or that they're using the facility effectively to save the maximum number of people. At every hospital, there's an entry point where choices have to be made about what happens to each prospective patient. Will this patient be admitted? And if so, where will they go? Do they have to go to the intensive care unit, or will they go to an isolation ward or to a general ward? I doubt China is making these decisions well because they weren't prepared. In fact, no one is prepared. Even in the United States, the healthcare system is finely tuned for the mix of patients we already have. A hospital might have its cardiac ward and its cancer ward, and most of those beds are already filled with routine patients. It might have only 10 ICU beds for emergencies because that's the number of emergencies they normally have. If they get slammed by 1,000 virus patients demanding to be seen, then they're going to fill up those beds on a first-come, first-served basis, and they won't know how to deal with the rest of the people. When and if the virus invades the U.S., authorities might have to do what they did in China, which is set up temporary hospitals to deal with the influx. Gymnasiums can be turned into makeshift hospitals, but then how do you staff them? All the doctors and nurses are already at their original hospitals. So who's going to man these new makeshift hospitals? What's to prevent them from turning into pandemonium? Our only real hope lies in slowing down the spread of the disease to give us more time to prepare. This means educating people on how to avoid infection. People will pay attention to these instructions if they know their lives depend on it. If you can limit the number of new infections every day, then you give your country more time to develop new systems to handle the influx. Unlike the medical systems we are used to, these systems are going to seem imperfect and brutal. You can no longer say we're going to save every patient. What you have to say now is we're going to save as many people as we can with the limited resources we have. This is a brutal philosophy because it means many people are going to be explicitly denied care, and these people won't be happy. So this medical model of triage can be extended to all of life. In everything you do and in every decision you make, you are engaged in triage. You're not going to be able to do everything and go everywhere, just like you can't save everyone during an epidemic. You have to parcel out your limited resources in such a way that you get the most gain, which actually means denying your resources to many noble causes. Triage isn't just about selecting things, but about deliberately not selecting things if they get in the way of your long-term goals. So I hope you can begin to see how the concept of medical triage can morph into a whole philosophy of life. This is what I tried to do when I invented Triagism back in 2015. Maybe it's time for me to reactivate that project. Triagism. How do you get the most you can from the limited resources you have? I'm sure there will be plenty of opportunity to think about triage in the coming weeks. Everyone will be asking themselves, if I catch this disease, what's going to happen to me? What happens to people when they go to the hospital and there aren't enough beds? In country after country, we're going to start putting triage into action, and we're going to be testing it, and we're going to be seeing what works. I didn't start this epidemic, and I don't control its spread, but if it's going to happen, at least I can use it for something. It can help me refine this philosophy that I had forgotten about. Assuming that you and I both survive, we might come out of it with some new tools for dealing with life. The main lesson of triagism is that there are no perfect solutions. There are only solutions that are relatively better than others. It all depends on your resources and how you choose to divvy them up.